Well, at this point, all hospitals across Michigan are being encouraged to conserve their supply of IV bags because it certainly looks like there's going to be some kind of shortage. We just don't know quite the extent of it at this point. Now, the facility we're talking about, it's called Baxter near Asheville, North Carolina, one of the hardest hit areas. And typically on an average day, they produce 1.5 million bags of IV fluid. And right now they're producing 0.
It's an issue that's impacting all hospitals across the country.
Hospitals here at home bracing for an IV solution shortage. The plant that supplies 60% of the solution in the U.S. shuts down. Floodwaters damage roads and wiped out a bridge that leads to the Baxter Healthcare Corp plant last week near Asheville, North Carolina, causing the shortage of one of the most essential tools to administer medicine.
A lot of them do rely or purchase materials from Baxter.
John Karazinski, a spokesperson with the Michigan Health and Hospital Association, says it's capturing the attention of the 128 hospitals in the state they represent. The situation causing rationing of IV solution, dextrose, a sugar fluid, and dialysis solution, which treats patients with kidney failure.
It seems like it will vary for each different hospital and health system depending on how much IV solution they have available.
Corewell Health says they're in constant communication with Baxter and are encouraging their teams to conserve IV fluids when possible. The University of Michigan Health System doing the same. They say in a statement, in part, University of Michigan Health anticipates a supply shortage in the coming weeks of large volume IV fluids. And Henry Ford Health says they too are optimizing supply. All 3 hospital systems say patient care is paramount.
Baxter is receiving a lot of help down at that facility through FEMA and some other federal officials as well as state officials to try to help move some of the material that is available at that facility.
Baxter put out new information Monday saying that they have resumed some shipments to hospitals and dialysis patients after last week's temporary hold, and say they're working on Plan B as they make substantial repairs in and around the plant.
We're also in communication with federal officials to look at other ways that alternative Baxter facilities may be able to be approved to distribute some of their solutions to.
As we said, Baxter releasing some new information late today, some promising information. They were able to assemble some kind of rock bridge to get to the facility, to get some of the remaining IV bags out on trucks and out to other shipment facilities. And they also got power back in the plant. So that's relatively good news. Now, the Michigan Health and Hospital Association, who we talked to in that story, they say if you have any upcoming procedures, any trips to the hospitals planned, check your patient portal before you go. The health systems have been very active in updating their patients on any changes that may come. Reporting live in Southfield, Jessica Dupnack on The Edge.
Yes, because the alternative certainly is not a good thing. And like the pandemic, where we saw a lot of these hospitals and a lot of these health places where they had to pool their resources really to get everything together just in case to be able to save some of these lives.
Yeah, and Taryn, we've seen at other hospitals across the country taking a little more extreme measures, and here at home, even canceling some of those elective surgeries, kind of preparing for this potential shortage that we might see. I haven't heard that quite in our state yet, but we'll see.
Yeah, certainly makes sense. You have to prioritize. Jessica, thank you.